Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. A recent study published in the Journal of the American Medical Association found that during the COVID-19 pandemic, there has been a decrease in cancer diagnosis by 46% of 6 of the most common types of cancer. Here to discuss this with us today is Dr. Nabil Wasif, the Chair of Surgical Oncology at the Mayo Clinic in Arizona. Welcome, Dr. Wasif, for being here today. Thank you for your time.
Thank you for having me. It's my pleasure.
Well, I love to learn the things that I get to learn by speaking to all of our experts. And this is something we've read about, that people have been going to the doctor less. So I think it makes sense that they're also going less to have some of their major medical investigations performed. What accounts for the decrease in cancer diagnosis during the pandemic?
I think time will really tell us what the underlying reasons are, but we can speculate that putting off routine screening tests at this time because of the pandemic means that early cancers are not being detected in the frequency that we usually see them. And patients who are having mild symptoms may not be seeking medical attention, whereas under normal circumstances, they may have gone to see their doctor right away and have uncovered a problem early instead of writing it out.
The JAMA study looked at 6 types of cancers that are common in the United States: breast, colorectal, lung, pancreatic, gastric, and esophageal. For which types of cancer is routine screening recommended?
So currently in the United States, routine screening is recommended for breast cancer with mammography, cervical cancer with pap smears, colon cancer with colonoscopy, and for smokers, CT scans for lung cancer.
And I think some would say, well, it's only a few months that we've been putting this off, but what would the risk to an individual be if they put off their cancer screening and then have a cancer diagnosed later?
So the main risk is that instead of a cancer being picked up early on a screening test before the patient's having any symptoms, it gets diagnosed at a much more advanced stage when the patient actually has symptoms and are forced to seek medical attention. Now, this has really important implications because we know that for most cancers, your best chance at cure is when we pick it up early. And as the cancer grows undetected, it has more opportunity to spread. Once the cancer spreads, then we really lose that opportunity, that chance to cure that patient.
So is it fair to say then, Dr. Wasif, that certain options to treat cancer may not be available if someone does not have their cancer diagnosed at an earlier stage?
Well, we may still have the same treatment options, but those treatments are just less effective.
Is it safe to go to your provider for a colonoscopy or a mammogram, both of which you mentioned? Is it safe to do that right now?
I cannot emphasize this enough. Yes, there's a risk from COVID, but taking simple, sensible measures that everyone by now is educated on, masking, hand hygiene, social distancing, really reduces that risk to acceptable levels. In fact, you're probably taking a bigger risk on by skipping your screening.
Are people delaying just the screening portion of this, or are there people who are delaying their actual cancer treatment because of COVID-19?
So the good part of this is that the cancer treatment itself is in the hands of physicians. And the physicians realize that delaying cancer care and treatment has negative impacts on the patient. So for example, if you have surgery for colon cancer and you have been recommended chemotherapy, there is a certain window of time in which you have to receive that chemotherapy. If there's delay beyond that window, that chemotherapy is ineffective, which means you now have a higher risk of that cancer coming back. In particular for surgery, that's even more important. Cancer surgery is not considered elective, where it can wait more than 30 days, again, primarily because the longer you wait, the more the opportunity is for that cancer to grow and spread. So there are no delays in treatment from our end. The problem, of course, is the patients have to get to us in a timely fashion for that treatment to be effective. And what the study in the JAMA paper shows us is that there's a drop-off of about 25 to 50% in the number of patients who are being diagnosed, which suggests that these patients are going to show up later and show up in more advanced stages than we're used to seeing them.
So that sounds like there may be a spike in cancer diagnoses perhaps later in COVID-19, or even when this clears, so to speak, if we can look forward to that.
Absolutely. I think we all expect an increase in the incidence of patients who have skipped screening now during the pandemic and are going to show up later for medical care. And we can handle the increase in numbers. But what I worry more about is the impact that this delay is going to have on our chances to successfully treat those patients.
Is there anything that Mayo Clinic is doing in particular to make it safe for patients to come have their cancer treatment during COVID-19?
Mayo is taking what I would say maximum precautions. And even when we had our peak here in Arizona, there were very few cases that were secondary to transmission in the hospital. The majority of cases seen in hospital employees were in people who had picked up the virus not in the hospital, but out in the community, going about their daily lives, which means that the hospital was actually a safer place to be than being at home or being outside. And the main reason for that is because the level of precautions we had in the hospital were much more stringent than you would see out in the community. Universal masking, exceptional hand hygiene after every patient contact, personal protective equipment or PPE, and then isolation of any patients with COVID or even suspected of having COVID. So cancer patients, particularly those on chemotherapy, are a vulnerable population. So we go the extra mile to make sure that they receive their treatment in a safe fashion when they're in the hospital, and that they're educated on the kind of precautions they need to take when they are at home.
And I've had a number of patients comment to me about how much they appreciated that Mayo is taking extra care with patients during this time, and they are not haven't been upset about the screening process or about the extra time that it takes, because they appreciate that level of concern. I wanted to ask you on a separate topic about flu vaccinations. If patients are concerned about a cancer diagnosis, should they have a flu vaccine? What are your recommendations in that regard?
If there is one year that the flu shot is even more important than usual, this is it. You may have read about concerns, a double whammy with the flu and the COVID doubling up in the winter months. And we may or may not have a COVID vaccine by the end of the year, but we will certainly have a flu vaccine. And I would encourage anyone listening to this podcast, to get it and get it early. As an aside, if we continue to adhere to masking and hand hygiene and distancing guidelines, then as an added benefit, not only are we going to reduce the COVID numbers, we're also going to reduce the flu numbers.
That's a very positive thought for the day. Thank you so much for that. Our thanks to Dr. Nabil Wasif, the Chair of Surgical Oncology at the Mayo Clinic in Arizona. I hope that you learned something, as I did today. Get your flu shot and keep up with your cancer screening. Thanks everyone for watching and listening, and we hope you have a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.